Hello, everybody. Today we are starting a new series on spine care, and so happy to have with us, we have Dr. Beth Gibbons. She is a neurosurgeon with Banner Health. Dr. Gibbons, thanks for joining us.
Thank you for having me.
All right, back pain, spine pain, very, very common here. So what do people need to know when it comes to, okay, initially treating that back pain or diagnosing that back pain and understanding when it's time to seek professional care?
So oftentimes the most important thing is to give it a little bit of time, whether you've done something that's very active and you're sore and you're achy, or whether you just wake up with pain. If it is not debilitating, typically rest, some heat or ice, anti-inflammatory medications. Give yourself a couple of days, see where things are trending and how you're feeling. And if pain becomes severe or debilitating from the outset, it's certainly reasonable to seek treatment immediately, either with your primary care physician or in the ER. If it is manageable and over a couple of days is getting better, it's likely something that you can continue to manage without necessarily needing to see someone.
Okay, you said active, and as we get older, back pain starts to happen even when we're not active. So is there any difference there when deciding when to seek care?
Not really. It's the same both ways. Even if you haven't done anything and you wake up one morning, you've got horrible pain in your back or something like that, it is still reasonable to follow the same steps in treatment and see where things settle out over a couple of days.
Okay, and as you know, when people experience that back pain, the first thing they do is probably going to jump online, start doing some research. So what are some tips for folks who go through that process, who are probably looking to self-diagnose and treat online, but then also looking for that, that professional, that doctor that could potentially treat them?
So it's very reasonable to go online, very reasonable to look things up. I would recommend either professional websites from universities or hospitals and things like that, and really try to avoid forums or question and answer places and things like that. The information is oftentimes not as accurate and sometimes scary and not as helpful. And so any of the university websites, hospital websites, Banner Health has a website, and those types of things are going to give much better information in general.
All right, Dr. Gibbons, thanks so much. Great information, great perspective. Thank you.
You're welcome.
And thanks for watching, and we'll see you next time.